diabetes insipidus. So this is different to diabetes mellitus, which is your typical diabetes with insulin and metformin. So the definition of diabetes insipidus is essentially when you have large volumes of dilute urine, and the main causes are due to two reasons. It's either due to impaired water resorption by the kidney due to a decrease in ADH secretion, or an impaired response of the kidney to ADH. So ADH stands for antidiuretic hormone. So this prevents you from going to urinate as much because diuretic is passing lots of urine, and an antidiuretic hormone is the opposite of that. So in terms of the causes, we can break them down into cranial and nephrogenic. So cranial reasons are either idiopathic, congenital, or due to tumor or trauma. Nephrogenic is also possibly genetic due to drugs such as lithium and chronic renal disease. Clinical features, as you'd expect, is polyuria, lots of urination, polydipsia, very much thirsty, dehydration because of loss of so much fluid, and you get hypernatremia. In terms of the investigations, you can do UNEs, calcium glucose levels. Importantly, you want to do a paired serum and urine osmolality because you'll have an increased osmolality in the plasma and decreased osmolality in the urine because you're releasing so much dilute urine. In terms of another investigation, you can do a water deprivation test, which tests the kidney's ability to concentrate the urine. Management can be broken down again into cranial and nephrogenic. Cranial, we can give desmopressin, which is essentially the effect of antidiuretic hormone. So it causes that antidiuretic effect, prevent you from urinating as much. Or nephrogenic, where there is a impaired response of the kidney due to ADH, we can give benzoflumethiazide. We can give also NSAIDs, because prostaglandins normally inhibit the action of ADH. So if we give NSAIDs, which inhibits prostaglandins, we remove that effect. And how benzoflumethiazide works is the thiazides remove the solutes in the urine because there's an increase in plasma osmolality. So it removes that and it decreases that effect.